This conference will now be recorded.
Hello students, I'm Dr. Divya from TeenEinstein. So this is the last class of this chapter, 8th chapter, Human Health and Diseases. So hope up to this, whatever we have discussed, you don't have any doubt. So in the last class, we had discussed about AIDS, cancer and all. AIDS means acquired immunodeficiency syndrome. These AIDS, cancer and all, these are important topics for NEET and your board exam. So just the important points I'm just discussing now. So this AIDS means it is a life-threatening disease. It's chronic disease, chronic condition, and it is caused by which virus? Human immunodeficiency virus. So this can damage your immune system. Just the important points I'm just giving, just to remind you once again about this. This topic is very important, especially for your NEET exam. So this human immunodeficiency virus or HIV that can damage your immune system. Okay, that's why that immunodeficiency, that patients which are affected, women are affected with this HIV, they are feeling that immunodeficiency for any disease, they are not able to withstand or they are not able to adjust with that disease because they are feeling that kind of immunodeficiency, that our immune system will be very weak if it is getting infected. And this HIV that interferes with the body ability to fight against the infections and diseases. So that is a problem. That body of that infected person is losing that power of fighting against infections and diseases. That power is losing. That is becoming deficient, or that deficiency immune system is becoming deficient, or that power is losing. And how it is spreading this disease? By blood products or blood transfusions, and then by unprotected sex, then mother to baby. All these kind of chances are there to spread this disease. So mainly that spreads by unprotected sexual contact. Okay. Then treatment can help this disease, but this condition can be cured. There is no cure, complete cure for this disease, but treatment will help that person to survive. Okay, so this can this infected people, they can last for or they can live for years, but the problem is lifelong that infection will be there. There is no complete cure. And AIDS, AIDS require medical diagnosis, right? Then another serious disease is cancer, which you have learned. In the case of AIDS, what and all you need to learn? For AIDS, acquired immunodeficiency syndrome, how it is affecting body, then what and all or how it is getting spreaded from one person to another person, how it is getting transmitted, that mode of transmission. Then next, how is it curable or not? Okay, these many things. What is the condition of the body if one person is getting infected? These many things you have to learn point wise. Then next, this is this cancer that we have learned. Cancer, this is also very important. This is actually cancer means that is a large group of disease. Okay, so it is I said in last class, I explained about the cell division. There is an uncontrolled cell division in the case of cancer. So cancer means that is a large group of diseases. There is not a single type. Different types of cancers are there. So it is a deregulation of cell growth. Cell growth is not regulated properly. In that condition, cell division or cell growth is not controlled. It's not under control. So in medical terms, it is called as malignant neoplasm. Okay, neoplastic cell. Cancerous cells are called as neoplastic cell. So malignant neoplasm. That is, in medical terms, how we will call cancer? Malignant neoplasm. So this unregulated cell growth that forms tumor. Okay, that forms tumor or cell growth. Like a bunch of cell growth. So this unregulated cell growth or uncontrolled cell growth that may lead to tumor formation. So anywhere in the body, this condition can start. Okay, there is no particular place for that. Cancer. Yeah, hope you have heard about breast cancer. Then in uterus also that kind of growth will be there. Then bone marrow cancer, blood cancer, anywhere the possibility is there. So cancer that is caused by mutations in genes, right? So in normal condition, in one cell, how one gene will act? That cell will divide, that cell will grow, that will produce, the genetic material will birth, and that will produce particular proteins. All these things will be in a proper way, right? When one gene is getting mutated, there is a mutation in one gene, that changes, the entire genetic material is getting changed. Instead of producing a normal protein, the sequence will change. So instead of getting a protein named A, that will give some altered version of that A. So that will affect the cell growth, right? So the cancer it is caused by the mutation in gene. That means the genes are normally controlling that work, all the works of a cell, right? Especially cell division and cell growth, all is under control. So all these are genetically controlled. So when errors are coming in cell division, that can cause genetic changes, right? So that genetic changes that causes cancer. Many hazardous substances we have learned, like chemicals, some things like hazardous chemicals and all there. Then smoke we learned. Then radiation, some kind of radiation, everything. All these type of things may cause cancer. Okay, so chemicals like cigarette smoke. That's the main thing that leads to lung cancer, right? So cigarette smoke, then ultraviolet rays from sun, UV rays from sun. We used to say we should not get exposed to UV rays for a long time, right? So that and all causes DNA damage. The damage of that cell's DNA so that it will get altered. So this DNA damage or that DNA damage may cause changes in the cell and that results in cancer ultimately. So some type of cancers that can be inherited, some type. Then carcinogens, cancer causing agents, those are called as carcinogens. So carcinogens like chemicals, then tobacco, alcohol, radiations like UV and all, they are considered as main cause of cancer. Okay. Then different types of cancers we have learned. What are all they? Carcinoma. Carcinoma means what? Cancer condition of epithelial cells. For epithelial cells, cancerous condition is coming means that is called as carcinoma. Then sarcoma. Sarcoma is another type, that is bone and soft tissue. Sarcoma is called as the cancer of bone and soft tissue. Then melanoma. Melanoma means that is a serious type of cancer that starts in the cell that begins with melanocytes. Okay, when cells the starting stage of that cells are starting with the melanocytes. In that kind of cancer, the dangerous type of cancer, and that begins in the melanoma. Sorry, melanocytes. So that is called as melanoma. Then how to diagnose this cancer? At earlier stage, if you are detecting means we can cure. So for the diagnostic methods, doctors are using different types of diagnostic methods. They are biopsy, then radiography, then computed tomography, then magnetic resonance imaging, MRI. Computed tomography means CT. Then molecular biology techniques, different types of molecular biology techniques they are using. Then so many lab tests. Through all these things, they are detecting or they are diagnosing the disease. Then we learned about tumor. Tumor, two types, benign and malignant tumor. Benign means it is non-spreading. Malignant means it is spreading. When that cancerous tissue or cell, it is moving through bloodstream and it is moving and reaching some other place, means there also that tumor growth will start. That type is called as malignant tumor. Then through surgery, chemotherapy, radiation therapy, then immunotherapy and all, it is getting treated. The treatment methods, which are the surgery, chemotherapy, radiation therapy, then immunotherapy, all these are used for the treatment of cancer. Got it? So these many important things we have learned. Then we have learned about drugs, some kind of drugs, and the drugs which are obtaining from particular plants we have learned, and where it is acting in our body. All those we have learned. Then now here drugs like barbiturate, then amphetamines, then benzodiazepines. All these and some kind of similar drugs like this, they are normally used in medicine. Okay, these drugs and are normally used
This conference will now be recorded.
So when these drugs are used in medicine in certain amount, or there is a ratio of combining these drugs with medicine, so that will get adjusted with that patient also. So that mental illness like depression, then insomnia, and for all these kind of diseases or illness, mental illness, we are using these particular barbiturate, amphetamine, then benzodiazepine, all these drugs in certain proportion for the treatment. Treatment like insomnia, depression and all. Because for that kind of mental illness, these drugs are useful. But that will be used in certain proportion or certain quantity. Okay. So when we are using more than that, that will affect our health. So then another one is morphine, which we are using as medicine for medicinal usage, what and all, which and all drugs we are using. So morphine means it's a sedative or it is used as a painkiller, and for patients, those who are undergoing for surgery and all, it is very useful, right? It is used as a sedative and painkiller. So morphine, which is another important drug. This morphine is, it's very effective painkiller and sedative. Okay. Then some other plants, their fruits, seeds and all, which are all having some kind of hallucinogenic properties. So these and all used as folk medicine. In folk medicine, they are using such things. And for religious ceremonies and all, they are using such things. Okay, for fruits, seeds and all, which are all having that hallucinogenic property. They are used. From several years, they have been using such things for folk medicine. Then other than medicinal uses, when we are using these drugs, or the frequency of usage that is increasing, or the quantity or the amount which we are using that is increasing, means that is affecting the physical and physiological health of body functions, and that is called as drug abuse, because more than a prescribed quantity or a prescribed frequency we are using that, and without any knowledge, roughly we are using that. So that may damage our health. Then, next is in drug and alcohol abuse, smoking. Smoking also very injurious. That is very injurious to health. And human beings, more than 400 years, tobacco has been used by human beings. So it is smoked, then chewed, and used as a snuff. It is used for smoking, then chewed or used as a snuff. So tobacco contains, you know that you have learned earlier also in previous classes also we have discussed all these things, nicotine and alkaloid. So tobacco is having, or it is containing nicotine, that is in which group that belongs to alkaloid. Okay, nicotine is an alkaloid. So this nicotine, how it is working in our body? Nicotine that stimulates the adrenal gland. Okay, adrenal gland, and if it is stimulating the adrenal gland, how it will work? Adrenaline and noradrenaline. Adrenaline and noradrenaline that is released into blood circulation. And both this adrenaline and noradrenaline, what that will do? That will raise the blood pressure and that increases heart rate. That increases heart rate and increases blood pressure. Then smoking. Smoking, you know that increases lung cancer, chances of lung cancer. Then urinary bladder, throat, bronchitis, then coronary heart disease, gastric ulcers. So everything, smoking is associated with all these diseases. Then tobacco chewing, we have learned. What is that? What it causes? That increases the risk of oral cavity cancer. Oral cavity cancer. Tobacco chewing, that is increasing oral cavity cancer. Then smoking. Smoking increases the carbon monoxide content in blood. Carbon monoxide content in blood is getting increased by smoking, and that will reduce the concentration of hembound oxygen. So while smoking, carbon monoxide content in blood, it is getting increased, and at the same time the concentration of hembound oxygen is getting decreased. So that causes oxygen deficiency. Oxygen deficiency in the body. Got it? Next. This, when one person is buying the packets of cigarettes, on that statutory warning will be there. Still, whatever may be, people will get that and smoking will get continued. Right? So that is a warning against smoking. What it says? Smoking is injurious to health. After reading that, again people will do the same thing. So for young or old, whomever it may be, it is very dangerous situation, and by knowing that dangerous situation, people are, again, by knowing that bad effects or the dangerous situation which they are going to face in the future, whatever it may be, they'll get addicted to these things. Tobacco, alcohol, then drugs and all. So they need to avoid this kind of habits. Then addiction. If one person is getting addicted, what they should do? They should get proper counseling and medical help. That is the important thing. Very important. They should get counseling, proper counseling. While counseling, they will teach the hazardous effects. Then they will give the proper medical treatment to come out of this addiction. Next. This topic is very, very, very important for 11th and 12th standard. That is adolescent and drug or alcohol abuse. Actually, this is not only important for your exam, this is important for your life. Okay. So adolescence, what do you mean by adolescence? Adolescence means the period and process during which a child becomes mature. That is the maturing age, or the child is becoming mature in terms of his or her attitude and belief. And in this stage, they'll become, or their participation in society, they are fixing it. Right? So the adolescence means the period, and that is a process in which a child becomes mature in terms of his or her attitudes and beliefs. And at this age, they'll be able to take a decision. They are thinking in their own way. So the period between 12 to 18 years of age, that may be thought of as adolescence. 12 and 18. This age, 12 to 18, this period, the period between 12 and 18, that is considered as adolescence, the age of adolescence. Then, that is the bridge linking childhood and adulthood. So the adolescence is accompanied by several biological and behavioral changes. You can see that in some kind of behavioral changes in this stage, adolescence, in the stage of adolescence. See, if parents are advising them, they won't like. If teachers are scolding them, they will get angry on teachers or they'll get irritated. So these are all changes, behavioral changes we can see in this stage. So adolescence, this is a very vulnerable phase of mental and physiological development of an individual. Adolescence is the age. It is very vulnerable phase of mental and physiological development of an individual. Okay. Then curiosity in this age, usually in this teenage, they'll become very curious. And for adventure and excitement and experimentation, then they'll become so curious towards these things, for adventurous things, for doing the bike riding, accident, these things are all common in this age. So they'll become more adventurous and excitement. They'll be having excitement. Then experimentation. They'll do so many things and experiments in their life. So in this age, they'll do all kind of what? Adventurous things. Right? So that this kind of habits or this kind of mentality that will motivate youngsters towards drug and alcohol use. That's why we said it's a vulnerable age. So that these kind of this adventurous mood or this adventurous mental situation that will make youngsters or teenagers towards drugs and alcohol usage. See, a child will be having, they'll be having some curiosity towards everything. So that motivates him or her to experiment. That curiosity, they'll be having curiosity towards this drugs. Oh, what is that? We should know what is that. Or what is the effect? People are saying, we'll get some kind of good effect after using alcohol or after smoking. So this kind of experiment mode or this curiosity or this adventurous mentality that will make them or that will make them to try once. We want to see what is that. So that mentality will move them towards this alcohol, drugs and all. Then when one person or one youngster is using starting stage, what they will think, okay, we'll try once. So afterwards, what they will do, okay, one more time. Then it will become a habit. So that time they won't be knowing about the complicated effects which they are going to face in future. So that will finally it will become a habit. So the first usage of drug or alcohol may be out of curiosity or experimentation, but later the child starts using these to escape facing problems. Okay, when they are knowing about the effect, see when some kind of situations are pressure situations like food pressure, they are becoming or they are in complete tension, what they will do? They will use this kind of drugs or alcohol, then smoking, all these habits they will start just to relax or just to get out of this. See, there is no proper solution. This is not a solution for their problems. Still, just to get relaxed, they will start using alcohols and drugs. Then the main tensions of teenagers are academics or examinations. That is having a major role, which is making youngsters to move towards alcohol and drugs. Main thing is examinations. But we can't avoid that. We can't escape from this examinations and academic performances and all. So what we need to do, we should face, however we can, we need to face it. Everyone can't become rank holders. Still, whatever it may be, up to your level, you know, out of 100, you can score 70, 60, 50, 80, 95, whatever it may be. You can perform in your level. No need to copy others. No need to get tensed about others' score and all. You have to try hard and get. So examination and academics, that gives more tension. From school, they will get one kind of tension. From parents, another tension. Everyone want to become doctor and engineer. So they will give more pressure on children. So this is also pushing them towards the drugs and alcohol abuse. Then perception among youth that it is cool or progressive to smoke, use drugs or alcohols. That is, in a way, major cause for youth to start these habits. First, see, this is a kind of relaxation for them from all these pressures. Then television, movie, newspaper, internet, with the help of all these things, they are promoting. In movies, you can see the hero is smoking, or they are using alcohol or using drugs. So, if hero is using, why can't we? That is the thought of teenagers, right? They are trying to copy that. But no one is thinking that is their profession, they are acting, but we are leaving. Okay, so other factor that has been seen to be associated with drug and alcohol abuse among adolescents are unstable or unsupportive family structures. That is very, very important. That also gives pressure. Unsupportive or unstable family structures. From family issues that also may lead to drug or alcohol abuse in the stage of adolescence. Because of the perceived benefits, drugs are frequently used repeatedly. Again, repeatedly they will start using these drugs. So the most important thing is that people are not able to realize, or in adolescent stage, they are not able to realize what they are doing. So in addiction and dependence, that is called as addiction. Continuously and repeatedly when they are using, that perceived benefits, due to that, these drugs are frequently used and they are repeatedly used. So the important thing is that one is failing to realize that the inherent addictive nature of alcohol and drugs. If you are repeatedly using, that is becoming an addiction. Okay, so addiction means that is the psychological attachment to certain effects associated with drugs and alcohol. So when we are using alcohol or when we are using drugs, some hallucinogenic effects that's created, right? That's been created. So for that, again, whatever I said, that relaxation, some kind of relaxing mode, for that, just for 2-3 hours or just for one day, they are using this. And finally, they are getting addicted to such drugs and alcohol. So these drive people to take them even when these are not needed, or even their use become self-destructive. This drugs and alcohol addiction, this actually that is spoiling one person. That we should realize. Next is, with repeated use of these drugs, the tolerance level of the receptor present in the body increases. See, when we are using these drugs, that tolerance level slowly it will increase, or the receptors in the starting stage, minute quantity also you can't tolerate, or the receptors will start reacting for such things, such small dosage also. But when repeatedly we are using, that tolerance level of that receptors will increase, or that tolerance level of the body increases. Then slowly that receptors respond only to higher dose of drugs. Right? That's very common. If you are using spicy things on starting day, it will be very difficult. And every day you are using the same thing means it will become a habit. So when we are getting more than that amount, when we are getting that time only, you will be able to realize that. Right? So consequently, the receptors are getting a continuously higher dosage when body is getting, that receptors won't respond for that, or receptors won't show any kind of higher response, or they will be able to tolerate that. So when that more than that dosage, when it is coming, that time only that reactions will start. So the alcohol, drugs or alcohol leading to greater intake and addiction. So when the dosage is increasing, that will become an addiction, for alcohol addiction or drugs, whatever it may be. So we should know that the usage of these drugs or even alcohol, that is leading to addiction. Okay, that we should be bothered about that. So this addictive potential of drugs and alcohol that pull the user into a vicious circle that is leading to regular use, that is called as abuse. So from which he or she may not be able to get out. So finally, when it is getting addicted to such things, alcohols or drugs, they won't be able to come out of that. And if one person is not getting, especially in this teenage, when they are not getting proper guidance or proper counseling, that time only they are getting addicted to this drugs and alcohol. Then addiction and dependence. So dependence, now we said about addiction, how one person is getting addicted. Then dependence means it is a tendency of the body to manifest a characteristic and unpleasant withdrawal syndrome if regular dose of drugs or alcohol, it is abruptly discontinued. See, you should know the difference between addiction and dependence. Okay, addiction means the regular dosage, when it is coming more than that, they are getting addicted to that. So continuously they are using and they are getting addicted to that. Then dependence. See, every day or repeatedly they are getting this kind of drugs or alcohol. They are depending on that. So without that they can't. Without that particular dosage, their body is reacting in different way. So that regular dosage of alcohol or drug, that is suddenly it is getting stopped, that will show some kind of withdrawal symptoms. Like those people, those who are drinking continuously using alcohol, when they are not giving that alcohol, they will show some kind of shivering and all. They won't be able to adjust with that condition. So this is characterized by anxiety, shakiness, nausea, and sweating. All these are starting when they are not getting that particular dosage of alcohol or drugs. So that is the dependence. So in these cases, that withdrawal symptoms that will be severe and that will become life-threatening, and in that condition, that person needs medical supervision. Okay. So when we are giving that particular dosage, again, the alcohol or drug, they will get relief. or they'll get relaxed. So suddenly when we are stopping that, those people won't be able to adjust with that. So again, they will show some kind of anxiety, nausea, sweating, shakiness and all. So to relieve, to get relaxed from such situations, again we need to provide that dosage. In such kind of people, they'll be at home, they'll be fighting and they won't be able to adjust with this society. That creates lot of issues in family and society. Then, immediate adverse effect of drugs and alcohol abuse that is manifested in the form of reckless behavior, vandalism and violence. Reckless behavior means some kind of actions. These people, that addicted people or dependent people, they will show some kind of action. They won't be even bothered about the people around them. And that may cause, their actions may lead to dangerous effects also. And they won't be even bothered about it is disturbing. Their actions or their behavior is disturbing others. So like that, they'll become totally ignorant about other people. They won't consider other people's emotions and all. They'll show some kind of reckless behavior. Then vandalism means they'll damage, they'll create damage to private and public properties. Then violence, they'll show some kind of violence. Then excessive dosage of drugs that may lead to coma and death due to respiratory failure, heart failure, then cerebral damage and all. Cerebral hemorrhage means bleeding. So excessive dose, more dosage of this drugs and alcohol that may lead to coma. The drug, if you are using more than prescribed dosage or continuous usage or addiction, that may lead to coma, then death due to respiratory failure, heart failure and all. Then combination of drugs or their intake along with alcohol, generally that results in overdosing and even death. Okay. So combination of drugs and or drugs which are taking along with alcohol, they result in the or their overdose that result in the death also sometimes. Then most common warning signs of drug and alcohol abuse among youth include drop in academic performance. Okay. So what are the common symptoms? Drop in academic performance, unexplained absence from school, college and all. The lack of interest in the personal hygiene, withdrawal, isolation, depression, fatigue, aggressive and rebellious behavior, deteriorating relationship with family and friends, then loss of interest in hobbies, then changes in sleeping and eating habits, fluctuations in weight, appetite. So all these things are the most common warning signs. Warning signs of drug and alcohol abuse. They will be continuously absent from the institute, college or school, whatever it may be. Then personal hygiene, they won't be bothered. Then they'll get isolated from other people because they won't show any interest in friends, then campus life and all. Then depression, then their behavior will be totally different. And always reckless behavior we have already mentioned with friends, family and all. They won't be having any kind of hobbies or like they will lose interest in such things. Then their eating habits, sleeping habits, everything will get changed. So all these things, they are the warning signs. Then for drug and alcohol abuse, some far-reaching implications are there. So that abusers, they are unable to get money or they are not able to buy alcohol or drugs means that they will start stealing. Then that adverse effect, it is just not restricted to the person who is using that drugs or alcohol. At the time, a drug or alcohol addict that becomes the cause of mental and financial distress. Okay, not only to the particular person, the whole family is getting affected due to the behavior of one addict. Okay. Then effect of drug or alcohol abuse. Those who are taking drugs intravenously, like injections and all, they are most likely to acquire serious infections like AIDS and hepatitis B. Okay, because they'll use the same needle for the drugs intake. So those who are taking drugs intravenously, they are having more chances to get this AIDS and hepatitis B, and the viruses which are responsible for these diseases are transferred from one person to another person by sharing these infected needles and syringes. That's why these intravenous drugs that by using the or by sharing the infected needles and syringes, there is a chance of getting serious diseases like hepatitis B and AIDS. So both AIDS and hepatitis B, both are chronic infections, you know that. And that may lead to death also. So both can be transmitted through sexual contact or infected blood. Then using alcohol during adolescence, that age, that is also having long-term effects. That could be, or during adulthood, that habit, it will become more. This drugs and alcohol, continuous usage, that may damage the nervous system and liver. Like liver cirrhosis, hope you have heard about liver cirrhosis, damage to liver. So continuous usage of drugs and alcohol. And the usage of drugs and alcohol during pregnancy, that is also, there is also a chance of bad effects to that fetus. It will adversely affect that fetus. Then some sportsmen, they are misusing this drugs to enhance their performance. What they will do, they will use, that means that is a misuse of narcotic, analgesics, anabolic steroids, diuretics and certain hormones in sports to increase their performance, to increase their muscular strength. Then that will increase the athletic performance, right? So the side effects of the use of anabolic steroids in female, what are the side effects by using anabolic steroids in female? That include masculinization, means features like male. In males, what are all features we can see? So that kind of features will develop in female. And increased aggressiveness. Then depression, abnormal menstrual cycle, excessive hair growth in face and body. Like characters in males, what and all we can see, such kind of characters will develop or start developing. Deepening of voice, all these things. These are the side effects of usage of anabolic steroids in females. Then in males, that will include acne, then increased aggressiveness, mood swings, depression, then reduction of size of testicles, then decreased sperm production, then kidney and liver, that disinfection will start, then breast enlargement, then premature baldness, enlargement of prostate gland. These are the side effects seen in men. In men, you can see These kind of side effects. And all these effects, the prolonged uses of this drug, that will lead to these effects. And in the adolescents, male or female, severe facial and body acne and premature closure of the growth centers of long bones that may result in stunted growth. In the stage of adolescence, this continuous or misuse of these drugs that may cause face and body acne in male and female, and premature closure of the growth centers of the long bones, and that may result in stunted growth also. Okay, then for prevention of alcohol and drugs abuse, what and all we can do? Pressures we need to avoid. Unwanted pressures we need to avoid. Then education and counseling. We need to give proper education about the hazardous effects of this alcohol or drug abuse. Then we need to give proper counseling for this. Then seeking help from parents and peers. If somebody is noticing, like your friends or someone is using this drugs or alcohol, we need to tell to parents or teachers and bring their notice to such people, because you can help your friend. Okay, then look for danger signs. All the symptoms which we are showing, we need to notice all those changes in this adolescent stage, because they'll be showing some warning signs, right? If they are having the habit of using these drugs and all. So that sign we need to notice. Then seeking professional and medical help. By chance, if somebody is in the way of using these drugs or alcohol, we need to take medical help to bring them out of that bad habit. Okay, so that's all about this chapter. So from this chapter, the main thing what all you need to learn is public health measures, then infectious diseases, how you will safeguard against this infectious diseases, then what are the control measures you will take for this infectious diseases, then different types of diseases like amoebiasis, malaria, pneumonia, ascariasis, all these things. Then waterborne diseases, how we will prevent. Then vaccines, immunization and vaccine, you have to learn about that. Then we have told about the HIV, AIDS and all expanded forms, AIDS, acquired immunodeficiency syndrome, like that you have to learn the expanded form of all this. Then acquired immunity, innate immunity, active and passive, all those things. Then antibody molecule, that is one diagram you need to learn from this chapter. Then about AIDS, about cancer, everything you have to learn in detail. Then alcohol and drug abuse. Then how you should help one person if they are having the habit of alcohol or drug abuse. So that's all. That much you need to learn from this chapter. If you have any doubt, you can ask me in the next class. Thank you.